Ed, can you hear me?
I sure can. Can you hear me okay?
I can. Let's give it, it's 11:58. Let's give it a couple more minutes, then we'll get started.
Okay, sounds good.
Let's give it one more minute, Ed, for people to get on, then we'll get going.
Sounds good.
All right, I think you can get going. 12:01. Just be respectful of everyone's time. We'll get going.
Okay. Well, good afternoon, everybody. Welcome to our fourth town hall meeting for the Shenango Forks Retiree Options. My name is Ed Vaughn from the ENV Insurance Agency. I'm the senior partner. I have Kristen Wall with me on the call today, as well as Cindy Wise from Humana. We're going to go over a couple of options here that the district is considering for healthcare options. But real quick, I wanted to do just a real quick intro to who the ENV Insurance Agency is. We'll answer a couple of questions up front. We'll go through the presentation, and then if we could hold all the questions until the end, and then we'll open it up for discussion. The presentation is designed to answer most or all of your questions. And then after that, if anybody wants to email us, my email address is on the website of the districts, and you can ask us any specific personal questions, or if you want us to verify doctors or prescriptions, we can do that as well. We are sending the information to both Humana and Aetna to just to give people a comfort level. So with that said, the ENV Insurance Agency is a 32-year-old benefit consulting firm. We employ about 40 people. We currently work with over 1,000 corporate accounts in the Northeast, but more important to you folks is we work with 130 different school districts. That's all that I specialize in. That's what I do. It's what I've done for the last 25 years. Before we get into the actual PowerPoint presentation that Joe has up on the board, I just want to address three, I guess, really big questions that we've been hearing from retirees during this process. The first question is, it's regarding the timing. You know, why are we having this discussion now in the middle of a pandemic? And I just want people to know that, you know, the district is not taking this decision lightly. And I don't think anybody would disagree that the timing with the pandemic is not good for anybody. But the fact of the matter is, life is still moving on, and all the districts, not just Shenango Forks, are faced with trying to balance their budget. And even though the budget vote got moved until June, they still have to get their ducks in a row. And then on top of that, if you're following the news, New York State is not sure how much aid the schools are going to get, and there's possible talks of making aid changes mid-year. So it's a very difficult time for everybody, but I just want people to understand that, this is not something being taken lightly. Several schools are doing what you guys are doing. I'm working with Canada Harry, who already made this or making this move with the retirees for 7-1. Maynard Waddington is moving their people 7-1. Harpersville is making a move 4-1. They're doing it as we speak. Owego is going 4-1. And the soonest the Shenango Forks could make this move would be 7-1. So I don't want retirees to feel that this would happen overnight or that they would get blindsided. But that's the first topic. The second question was, why are we using a consultant versus talking to the carriers direct? And we can answer that with a few different answers. The first one is not all the carriers will work with clients directly. Some carriers only work with consultants like myself. The second is a carrier can only talk to you about themselves. So Excelis can only talk to you about Excelis. Hartford can only talk to you about Hartford, Aetna, Humana, and so on. With a consultant, we're able to put together an analysis and compare the good, the bad, and the ugly about everybody, and also discuss with you, the pros and cons of each plan. That could not be done working with carriers directly. The other thing is the rates. The rates do not change. There is no rate discount if anybody doesn't use a consultant. The last answer, which I think is the most important, is ENV has a call center, and we have 9 people that are there 8 to 5, Monday through Friday, and we're there to be your advocate. In the situation where somebody has a question about their coverages or there's a possible issue, they can call my office. They will get a person that can walk them through whatever they need, and we're there to help them. That's very, very important. A lot of retirees have a hard time trying to understand sometimes what their benefits are, and if the carrier is pushing back, they don't know who to turn to. They'll now have us to turn to answer all their questions and to help them. That's been a very well-received program for all of my schools for over 20 years. The third thing is, if it's too good to be true, then it usually is. How can these carriers give us benefits that would be considered as good or better for a much lower price? And the answer to that is a few things. First of all, your coverage that you really have is Medicare. Excelis is your secondary payer, not your primary. So Medicare is paying 80% of your claims. However, the district is being charged as the same rate as the active people, as if they're paying all the claims. So there is no discount there. That's a huge difference in cost. The other thing is that when retirees go on Medicare plans, they go on a single. So whatever the single rate is, if it's $300, the family rate would be $600, just 2 times the single rate. Under our current Excelis situation, whatever the single rate is, it's a factor. So it's 2.5 times. So where the rate might be $800 a single for Excelis, you'll see the family rate's going to be $2,000, not $1,600. That's another big difference in cost. The third reason is that Medicare pays these carriers subsidies to pay these claims and to give them better benefits than Medicare currently is providing. So they're being subsidized by Medicare themselves. They're using some of the Part B premiums that you all pay for Medicare. So that is the main reason why these carriers can provide these rates. And you can see it's not just one carrier. I mean, Humana and Aetna and Excelis, these 3 options I have on these spreadsheets, all are substantial savings for the district and the retirees. And 2 of them are very close in pricing. You'll see Humana and Aetna are in the ballgame of right around $2 million in savings. So as we go into the PowerPoint presentation, which I'm going to go through first, it's really just a little bit of information about Medicare, just so everybody can understand the same terms that I'll be talking about in the presentation. The first thing is, we talk about the difference, what's a Medicare supplemental policy versus a Medicare Advantage plan. And a Medicare supplemental policy is just that. It's a policy that supplements Medicare. You still have to sign up for Part A and Part B. The deductibles are all covered. The co-insurance is all covered. But the Medicare sup policy will pick everything up, leaving the retirees zero out of pocket. So you won't see deductibles or co-insurance that need to be paid. With a Medicare sup, they rely on what Medicare, whatever Medicare says, they do. So if Medicare denies a claim, they also do. If they pay a claim, they pay it on top. With a Medicare supplemental policy, you usually have 3 cards: an actual Medicare card, a Medicare sup card, and a prescription drug card. Also effective 2020 on Medicare sup policies, CMS, which is Centers for Medicare Services, had made a change on Plan F. And Plan F is the plan that we use a lot because it's 100% coverages. There are no deductibles, there are no co-insurance, so it's the best plan out there. And what Medicare said was anybody that was 65 years old prior to January 1 of 2020 could still be on a Plan F plan. Anybody that turned 65 after January 1st, 2020 would have to go on to a Plan G, and a Plan G is the same thing as Plan F, except that the Part B deductible, which is $198, would not be covered. So you'll see in my presentation, that's why we don't really consider the Med Sup at this time. With this Plan G change, we would not consider that to be as good or better than what we have in place now. Medicare Advantage plans pretty much provide Medicare benefits through a private insurance company. It includes the Medicare Part A and Part B. Part D prescription coverage is also included. The out-of-pocket cost depends on the type of plan you purchase. So what we've done here is we have customized this plan based on the benefits you currently have through Shenango Forks. The other nice thing is it's one ID card for all benefits. The third thing on my sheet says Medicare Plans Network is irrelevant. When I say it's irrelevant, what I mean is compared to our current Excelis plan, we no longer have to be concerned about is a provider in a network. It becomes now, is the provider, will they accept Medicare or do they do Medicare assignments? Okay, 98% of providers across the country are involved in Medicare or Medicare assignment. With Excelis, 98% of the providers in the New York State area, our 31 counties, are part of their program. On a national basis, the number is 80%. So from a national basis, there are more providers that take Medicare than take the Blue Cross program. The next thing we talk about is the passive network. I just kind of really mentioned, from now on, as long as the provider accepts Medicare or Medicare assignment, the provider is considered participating with the plan. So we don't have to, as retirees are asking their providers, do you accept Medicare, or do you accept Humana or Aetna? What they really should be saying is, do you accept Medicare or do you do Medicare assignment? We are in the process of verifying for several people that their providers are all okay. Also, the retirees do not have to do anything when it comes to billing on the claim-wise. All the claims are processed directly with the carriers, and it should work just like it does now, very seamlessly and very smoothly. We get to some frequently asked questions, which these come from a lot of the meetings that I've done over the past. What is the difference between, Medicare Advantage and Medicare Sup, which we just talked about. But the reason I bring it up here again is that under the Medicare Advantage plans, for carriers to receive their subsidies and to keep their star ratings, they've got to provide amazing service and top-of-the-line benefits. So both Aetna and Humana are rated 4.5 out of 5 when it comes to stars. They're both highly rated from Medicare standards. Well, I have to switch doctors is always the first question that gets asked to me. And as long as your provider accepts Medicare or Medicare assignment, we shouldn't have any issues. As I've already said, 98% of the providers nationally will accept Medicare in some form. Now, there are providers out there that we call private contracting physicians that would say to me, Ed, give me $5,000 a year. You can have 24/7 access to me. Sign a private contract. Those providers don't accept any coverage, whether it be Excelis or Humana or Aetna. They don't accept anybody. And if you had a private contracting physician, you would already know that now because you would have already have signed a contract. How are claims processed? Under the Medicare supplemental policy, claims are submitted to Medicare first, and then they go to the carrier to be processed after that, and it's done seamlessly behind the scenes. Under Medicare Advantage, the claims are also into the actual carrier, not through Medicare. What tier is my prescription drug on? Right now, most of the people at Shenango Forks have what we call a two-tiered drug card. It's $2 for generic and a $10 copay for name brand drugs. That will not change. Okay, so it should be very simple. $2 and $10. There should be very little to no disruption with that at all. Now, as I say that, we are using open formularies, and the formulary is the list of prescriptions that people can use. Okay, so you have an open formulary on the Classic Blue. You have a closed formulary under the PPO, but under the Medicare Advantage plans, it's an open formulary. Drugs can change tiers. I tell people this all the time. They don't realize that drugs can go from a name brand to a generic. That happens very often. And sometimes the drug does go from a generic to a name brand category because maybe something got changed. It went from a low cost generic to a higher cost, and then they changed it. So what we've been told was, if the copay is going to go down, the changes can happen at any time. And if the copay is going to go up, it can happen once a year, typically on January. The industry standard is typically quarterly. The next question we get all the time is there a donut hole for us to be concerned about? And the answer is no. The one thing that you need to understand here is that we are not talking about an individual policy that you could buy off the street. You see them on TV all the time. They all advertise Aetna, Humana, United Healthcare, Excelis. This is a policy that you could not purchase on the street. There's a big discount on price. The benefits are going to be customized. And the big thing here is you do not have to worry about a donut hole. A donut hole is gap in prescription coverage. Anybody that knows anybody on an individual plan knows that they have dealt with that. You will not have to deal with that here. Is there a pre-existing condition clause to be concerned about? No. If you have any condition, if you have a heart condition, you've dealt with cancer, you've got diabetes, so whatever condition you have, there is no pre-existing condition clause to worry about. You'll be fine. What happens if my spouse is also over 65? If your spouse is also over 65, your spouse would transfer to the new Medicare plan just like yourself. What happens if my spouse is under 65 and I'm over 65? If you're over 65, you can go to the plan, and your spouse would stay on the active plan until they turn 65, and then they would move over then. Do I need to be enrolled in Part A and Part B in Medicare? The answer is yes. Just like today, you're enrolled in Part A and Part B, and you would need to still be enrolled in Part A and Part B through Medicare. What happens if I have any questions or problems? If you have any questions or problems, you can call our call center, and we'll take care of whatever issue comes up. And issues do come up. I don't care what carrier that I deal with. We deal with every carrier in New York State, and nobody's perfect. There is, things get miscoded. People have questions. Something got mishandled, and we're there to be your advocate and to get this taken care of. People have been, I think for the last really 2 weeks, have been calling myself, Kristen Wall, Cindy Wise, and we've been answering questions, helping them. And I think the biggest response that we've gotten from that is people are very happy that they're able to speak to somebody directly and to get a person that's there to take care of them. That's all the emails I've gotten have said that specifically. So we are there to handle your questions and issues. And my email address, again, is on the website from the district. If anybody wants to email us after the presentation with, a phone number, and we'll contact you back, and we can verify providers for you and verify prescriptions and things like that. The last page, this is a list of the school districts throughout Central New York and the Southern Tier that we've moved already to Medicare programs. In all full transparency, Shenango Valley has moved some of their people. They have not moved their teachers, but they did move the rest. And also Johnson City, who's not on this list, Johnson City has had Humana now for, I believe, 4 years. There was a gentleman that mentioned in our first call that he had contacted retirees from Shenango Valley, Deposit, Walton, and Johnson City, and he got back all positive feedback, except the person in Johnson City mentioned that they had to pay $20 for their copay for prescriptions, which is something I had to point out that's what their benefit design was. but that was their comment. So it was all good feedback from people that he had reached out to. And that's the PowerPoint presentation, really just on Medicare itself. The next thing that Joe's putting up here is the actual analysis that we did that takes your current Blue Cross Classic Blue plan, which is on the left-hand side, and then we put the Excelis PPO program, which is next to that. There's 6 people that are on that. And then we have the Medicare benefits to the right of that. Then we've got the Excelis Medicare program that they've quoted, followed by 2 probably on your copy. It looks like gray shading. Where it's gray, the benefits are going to be considered equal to or better than. What I've done here is I've put plus signs if it's a better benefit, equal signs if it's the same, and a negative sign if it's a negative benefit. And then I've done all the way across the board with Humana and with Aetna. So with that said, let me jump into the analysis. We'll go right down through this. You can see under deductibles, under the Classic Blue plan, an individual has a deductible of $50, and a family it's $150. Under the Excelis PPO, there are no deductibles, it's just copays. Under the Medicare program, Medicare has a deductible of $1,408 for Part A and $198 for Part B. Under the Excelis Medicare plan, that deductible would be covered, so there would be no deductible needed under the Excelis plan, so those benefits are going to be considered as good or better. Under Humana and Aetna, there are no deductibles to have to meet. Okay, so you'll see those benefits are going to be as good or better. Standard copay, under the Excelis plan, it's just co-insurance, so it doesn't apply. Under the PPO, it's a $10 copay. Under the Excelis Medicare plan, it does not apply as well, so they've matched the benefits. And it's enhanced over the PPO because there is no copay to meet there. Under Humana, you'll see it's a zero copay. A zero copay means when you go into a doctor visit or the hospitalization, you see zero copay, that means you pay zero. So those benefits there for Humana and Aetna are going to be as good or better than what we have in place now. Standard coinsurance. Coinsurance means 20%. That means you pay 20% and Excelis pays 80% until you reach an out-of-pocket expense of $400 for a single and $1,200 for family. That's the way your current plan is laid out. Under the PPO, there is no coinsurance, so it doesn't apply. Under the Excelis Medicare plan, there is no coinsurance. So the benefits are going to be as good or better. And under Humana and Aetna, same thing. There is no coinsurance to worry about there. So either doesn't apply or it meets what we have in place now. The lifetime maximum is unlimited benefits. Across the board, all the carriers have unlimited benefits. There's nothing here that's limited. The next category is physician office services. Under an office visit, it's currently subject to deductible and coinsurance under the Classic Blue plan. Under the PPO plan, it's a $10 copay. Under Excelis, you'll see it says 100% after Medicare. So Medicare pays their portion first, and then Excelis would pay the balance, leaving the retiree nothing to pay out of their pocket. So you can see that's going to be as good or better than what we have in place now. Under Humana and Aetna, you'll see there's zero copays, which means you pay zero. So they also are going to be as good or better than what we have in place now. A question that got asked to me yesterday during the daytime some point is what's the difference between a zero copay and 100% after Medicare? The answer is no difference. It's just the way that the carrier says it. They're both saying the same thing, meaning that the benefit is paid 100%. The retiree has nothing to meet out of their pocket. Chiropractic coverage. Chiropractic coverage is subject to deductible and coinsurance under the Excelis plan, which covers spinal manipulation only. Under the PPO plan, it's a $10 copay. And you can see under Medicare, Medicare coverage typically is for spinal manipulation only. And under the Excelis plan, that's what they cover. They do not cover routine. Okay, so they've got that. You'll see that that is going to match our plan or be better. Under the Humana program and Aetna, they're going to cover spinal manipulation with a zero copay, but they've also added routine maintenance care, which is a big added benefit. So both Humana and Aetna will cover routine maintenance care for chiropractic coverage. Next section is preventative, and you can see that all the routine physicals, adult immunizations, mammography screenings, pap smears, prostate cancer, bone density testing, all that's paid in full. And going across the board, whether it be Excelis, Humana, or Aetna, they're also going to pay 100% for all your well care visits. So there's either zero co-pays or paid 100%. We get to the next page, we get into routine vision exams. Now, one thing I should have mentioned as I started, we did make a few updates on this analysis, and I'll go over the updates as I go through the benefits. We did not send out another copy of the analysis because we didn't want to confuse anybody. We didn't want to have different versions of the analysis out there. So we did send the district an updated chart with the updates that were made from Humana. And the first one will be this one here on routine vision exams, because it's currently not covered under the Excelis plan, and it's not covered under the Excelis Medicare plan. It is, however, covered under Humana, where right now it currently says not covered. If you want to write in, you can say zero copay, one annual exam every 12 months, just like it does for Aetna. So those two plans will match, and they are better coverage than what we have in place now. The eyewear frames and lenses, under the Excelis plan, they will cover a set of glasses after you have cataract surgery, and that is very typical. That's also the way that the Excelis Medicare plan works as well. They will cover the cataract glasses after surgery. Under the Humana program, and Aetna is another upgrade for Humana, they're going to cover the eyewear with a zero copay, okay, for the eyewear, and there's also a $100 allowance every 12 months. So instead of where it says zero copay, vision discounts available through specific IMED plans, they've changed it to give you that $100 allowance, just like Aetna did, which can be used wherever you want to go. So that's both better coverages than what we have in place currently. Hearing evaluations currently would be subject to deductible and co-insurance under Excelis, and it's a $10 copay under the PPO plan. Under the Excelis Medicare plan, it's going to be covered 100% after Medicare. And under Humana and under Aetna, you can see it's a zero copay, one annual exam every 12 months. So that's going to be as good or better than what we have in place now. Hearing aids. Hearing aids are not currently covered through either Excelis plan. They're not going to be covered under the Excelis Medicare plan. They will be covered under Humana and Aetna. Under Humana, it says not covered. Discounts available through our True Hearing vendor. However, they have changed that to match the same benefit that Aetna is, which is a $600 allowance every 36 months. So now you would have that benefit from both of those carriers, which is an enhanced benefit to what we have now. Inpatient hospitalization, whether it be inpatient hospitalization, inpatient mental health, or inpatient substance abuse, they are all paid the same way. They're currently covered in full, and they will currently be covered in full through the Excelis Medicare plan, the Humana plan, or the Aetna plan. There's no difference in coverages there at all. And the same thing goes with inpatient physician visits, all covered in full 100%. Next slide talks about therapies. We got radiation therapy and chemotherapy. Oop, am I on the right page here, Joe? Oh, I'm sorry. You were right. I'm wrong. Got ahead of myself. The next page talks about skilled nursing facility. So currently skilled nursing is covered in full under the Excelis plan, and also covered in full up to 120 days under the PPO plan. You can see under the Excelis Medicare covers in full up to 100 days. So that is a negative benefit, it's less than what we have in place now. Humana used to say zero copay from days 1 through 100, then plan pays zero after 100 days. That has been changed to Humana will cover 100% unlimited days. It's a zero copay. So that is going to be as good or better than what we have in place now to also match the Aetna program. One thing that we were asked that we're in the middle of doing now is we're asking carriers, what is the criteria for skilled nursing? How do you determine how long somebody is in a facility or not? And we're waiting for those answers. I think what's going to come back is they should all be very similar, that they're using Medicare guidelines to determine when somebody would go from a skilled nursing facility to potentially home health care. But we're going to wait for those answers, and then we'll report that back to the district once we have it. But that was one question that got brought up that we're researching as we speak. But as we speak here today, skilled nursing, unlimited visits and days with a zero copay. So it's going to be as good or better than what we have in place today. Emergency care, next category. Emergency rooms are paid in full under the Classic Blue and it's a $50 copay under the PPO plan. Under the Excelis Medicare plan, it's 100% coverage after Medicare, so it's going to be as good or better. Under the Humana plan and Aetna plan, they're also zero copays, so it's also going to be as good or better than what we have in place now. The Aetna says includes worldwide coverage. So does the Humana. We'll talk about that. I actually have a column for international coverage, which we'll discuss here towards the end. The next category is urgent care visits. Urgent care is subject to deductible and co-insurance under the existing Classic Blue. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, it's 100% after Medicare. So that, you can see my signs, that's going to be as good or better than what we have in place now. Under Humana and Aetna, they are zero copays. So that also is going to be as good or better than what we have in place now. Outpatient surgeries are going to be covered in full under the Excelis plan, and under the PPO plan, it's a $10 copay. You can see under the Excelis Medicare plan, it's going to be 100% coverage after Medicare, so it's going to be as good or better. It's going to be a zero copay for Humana and Aetna, so that also is going to be as good or better. Office surgery, subject to deductible and co-insurance under Classic Blue. Under the PPO, it's a $10 copay. Again, you'll see under the Excelis Medicare plan, it's 100% coverage after Medicare, so it's going to be as good or better. Under the Humana or Aetna, it's zero copays, so it's also going to be as good or better. And you can see we're starting to get a rhythm here. On the Medicare Sup plan, everything's paid 100% after Medicare, leaving the retirees zero. Under the Humana plan and the Aetna plan, you can also see all these benefits have zero copays, which also means the retirees are paying zero. Diagnostic lab testing, you can see, is paid in full under Classic Blue, and under the PPO, it's a $10 copay. Under the Excelis plan, it's 100% coverage after Medicare, so it's as good or better. Under Humana and Aetna, it's a zero copay, so it's also as good or better. We get into therapies. We have radiation therapy and chemotherapy. Both currently are paid in full under the Excelis Classic Blue plan. Under the PPO plan, they have a $10 copay. Under the Excelis Medicare plan, both of those are going to be covered 100% after Medicare, so it's going to be as good or better. Under the Humana and the Aetna plan, you can see they're also zero copays, so they also will be considered as good or better. Outpatient mental health, subject to deductible and co-insurance currently under the Classic Blue, and a $10 copay under the PPO plan. Under the Excelis Medicare plan, it's covered 100% after Medicare, so it's going to be as good or better. Under Humana and Aetna, it's a zero copay, so that also is going to be considered as good or better. Alcohol, substance abuse for facility outpatient. Under the Excelis plan, it's paid in full for 60 visits per calendar year. Additional days may be available based on medical necessity. Under the PPO plan, it's covered in full. Under the Excelis Medicare plan, it's covered 100% after Medicare, so it's going to be as good or better. Under the Humana and Aetna, it's going to be a zero copay, which is going to be also considered as good or better, and there's no limitation to days. Another point I want to make out. Somebody asked that question yesterday. Therapies, physical therapy, speech therapy, occupational, pulmonary, and cardiac therapy, all subject to deductible and co-insurance on the Classic Blue. On the PPO, it's a $10 copay. Under the Excelis Medicare plan, it's 100% coverage after Medicare, so it's going to be as good or better. Under Humana and under Aetna, you can also see there's a zero copay, so it's also going to be as good or better. Diabetic supplies and equipment for education, currently subject to deductible and co-insurance under the Classic Blue, and under the PPO, it's a $10 copay. Under the Excelis Medicare plan, it's going to be 100% coverage after Medicare, so it's going to be as good or better than what we have in place now. Under the Humana and Aetna, it's a zero copay, so it'll also be as good or better. You can see under Aetna, it's got a include supplies for monitoring blood glucose. That's the same with Humana and Excelis as well. Just a note that they had put under their category. Durable medical equipment is a deductible and co-insurance benefit under Classic Blue. Under the PPO program, you pay 20%. Under Excelis Medicare plan, it's paid 100% after Medicare, so it's going to be as good or better. Under Humana and Aetna, they are zero copays, so they are also going to be considered as good or better. Prosthetics, currently covered at deductible and co-insurance, no calendar year maximum under Excelis. Under the PPO, it's a 20% co-insurance with a $15,000 calendar max. Under the Excelis program, it's 100% coverage after Medicare. No max, it's going to be as good or better. And under Aetna and Humana, you can see it's a zero copay with no max as well. So it's also going to be as good or better than what we have in place currently. Home health care, paid in full, 60 visits with 325 additional visits under enhanced benefits. Under the PPO, it's covered in full, unlimited visits. Under the Excelis plan, it's going to be covered 100% after Medicare, so it's going to be as good or better. And with Aetna and Humana, it's a zero copay. It's going to be as good or better. Now, the other point is there are no limitations to visits on Excelis here, Humana, or Aetna. And that's another point where you see some of the limitations on days and on the current plans. You don't have that under the Excelis, the Humana, or the Aetna when it comes to limitation of days. Hospice care, paid in full up to 210 days. Under the PPO, it's covered in full, unlimited days. Under the Excelis plan, it's going to be 100% coverage after Medicare, no limitation of days, so that meets as good or better. Under the Humana and Aetna, it's a zero copay with unlimited days, so that's going to also be as good or better. Dialysis, paid in full under the Excelis plan, and under the PPO plans, also paid in full. Under the Excelis Medicare plan, it's going to be paid in full after Medicare, so it's going to be as good or better. And under Humana and Aetna, it's also got a zero copay, meaning that that's going to also meet the as good or better. The last thing on that page is acupuncture. Acupuncture currently is not covered under either of the Blue Cross plans. It's not covered under the Excelis Medicare plan. It is, however, covered under Humana and Aetna with a zero copay. We get into the last page here, international coverage. I currently have that listed as TBD because we didn't have the information from Excelis, but I can tell you from my history, any emergency outside the country is going to be covered as any other emergency. So I would not see that any different here. So that we would have coverage there. Under the Excelis Medicare program, you can see emergencies covered within a 60-day period of travel, subject to a $250 deductible with a 20% co-insurance with a $50,000 lifetime max benefit. That is a less than benefit than we have in place now, so that's why I have that listed as a negative. So on your sheet, it might be a dark gray color. With Humana and Aetna, it's paid 100% by Humana. Obviously, it's limited to emergencies only. People are, I'm assuming, are not going to get routine physicals done in Italy or in Europe or on vacation. So the way they word it is just like we have with Excelis. Emergencies are covered 100%, and so they're going to be able to meet that benefit as well. Lifestyle benefits, currently under Excelis, they don't really have any of those additional benefits, and neither does the Excelis Medicare program. Both Humana and Aetna have what they call the Silver Sneakers program, or they have several discounts to several vendors for different things. There's different rewards programs. The Silver Sneakers program is probably the most popular program out there. It's a gym membership program. You can be a member to as many gyms as you want, whether you're up here or in Florida or wherever you might be. So that's a really great program. So that's an additional benefit than you have now. And then the last little section on here, as far as benefits go, is the prescription coverage. Currently, people that are on the Classic Blue have a 210 drug card, which means they pay $2 for generics and $10 for name brand drugs. If they get an 90-day supply, they get a discount. They pay the same copay. So there's an advantage there. There's no annual deductible they have to meet or annual out-of-pocket. Under the PPO plan, if anybody's on that plan, they have what's called a 51530 drug card, which means they pay $5 for generic drugs, $15 for preferred name drugs, and $30 for non-preferred name drugs. And you can see to get a 3-month supply, there is no discount, or excuse me, there is no discount, so you're paying the 3-time copays. There is no deductible, and you can see there's an annual out-of-pocket max of $3,000 for an individual and $6,000 for family. Under the Excelis plan, they did match the 210 drug card, just as we have it now, so that's the same. They did not give us the information on the 51530. We do believe that they would match and allow us to have both, but we have not received that information from them yet. We don't perceive it to be a problem. Under Humana and Aetna, they also have matched our enforced drug programs. So it's a 210 for people that are on the Classic Blue and a 51530 for people on the PPO for both carriers. One slight difference is under the Aetna, they did cut the out-of-pocket maximum for the PPO in half for the rest of this year based on this, based on usage. So we have there. One thing I want to point out here too is, and I think some of the retirees had mentioned it, or there might be an email that's going around. It is possible that Excelis, as your secondary carrier, is covering your Excelis deductible and your co-insurance. So if you're thinking, well, geez, I don't pay the deductible, or I don't pay the co-insurance, that is possible, and that's a good thing. I want to make sure that you look at, when we look at this analysis here, none of those benefits where Excelis may be covering the deductible or co-insurance would be a deviation of benefits. Okay, so there's still plenty of pluses on the right-hand side of the sheets. There's plenty of benefits with unlimited days, and then you have all those additional benefits from hearing and acupuncture and vision and things like that. So there's still plenty of positives, but the point I want to make out is there are no deviations to the plan. Okay. Also, I want to make another stance is that the district is also said to me that if there are any unforeseen expenses that would have been covered under the Excelis plan, and for whatever reason are denied under the whatever plan we choose, the district is willing to self-insure that. Now, as I say that language, the self-insurance portion, has to be negotiated, and that has not been done yet, but that is something that has to go through the negotiation process, and the district is willing to put that on the table to be discussed. It's just another layer of letting people know that they're very confident in these plans. The bottom section of this, we get into the rates. You can see on the left-hand side, the Excelis Classic Blue is $813 a month per single. That's the gross monthly rate that the district pays to Excelis for single coverage. And then $2,035.97 for family. Under the PPO, it's $759.85, and for family, it's $1,885.81. And then you can see under the Excelis plan, the rate for single is $489.54, and you would double that for family. And then you can see under the Humana plan, for the 210 program, it's $305.19, and for the 515.30, it's $251.64. The rate for Aetna is $369.19 per single per month, and $337.78 per month per family. So you can see under the recap sheet that the Excelis program would save the district approximately $1.5 million. The Humana program would save approximately $2.1 million, and the Aetna program would save about $1.9 million. Now, I want to also point out that these Humana rates will change slightly because we have done several upgrades. We just not have changed the sheet to confuse anybody with different versions of the analysis. We will have that finalized and given to the district very shortly, so they'll have that. I don't anticipate that being a huge difference in cost, but the savings will go down slightly for sure. What I did, another question that got brought up too, before I forget, is somebody had asked the district, is this going to be a short-term solution for us or a long-term solution? Are we looking past just this first year, or how do we know that we're not going to get, a huge increase and then we're going to have to make a change and so forth? And so what I did is I took the Humana rates and I increased them 9% a year, and it would take until the year 2031 to equal the in-force Excelis rates today. If I then took the same formula and increased the rates by 9%, and also increased the Excelis current rates by 5%, which is also conservative, in the year 2031, there was still a substantial difference in cost. So the answer to that question is, this is not a Band-Aid fix. This is a long-term solution. Many of the districts that have moved on to these Medicare programs have been on them for years, and I do not have one district that went down that road that has moved back or away from them. I also took the liberty to, and I don't know, I know different negotiating groups or different bargaining groups pay different amounts for their coverages, but what I did is I just took two different numbers. If a retiree is paying 10% currently of their coverage, what does this mean to them? So if I take the current rates and I take that 10% of the $800 a month, it comes to $81.39 a month, which means that a retiree is paying $977 a year for single coverage, and they're paying $2,436 for family coverage. That same 10% under the Humana column would mean a single person would pay $366 per year, and a family would pay $732 per year. That's a savings of about $600 per year for a single, and it's a savings of $1,700 a year per family. That's a huge difference. So now that generated another question. So my savings on the bottom of this analysis that says 2.1 million for Humana, that's a gross number. Okay, that means that's a total savings, which includes savings for retirees and the district. But I want to reassure people the district is still saving the majority of the money because they're paying the majority of the premium. So if the average retiree is paying 10%, if you took 10% of the $2.1 million, that would come to $210,000, and it would still mean that the district is saving about $1.9 million. Okay, so you can see they still would be saving a majority of that money. And I also did one for 15%, which means if the retiree was paying 15%, because I believe I spoke to somebody who did pay that number, a single person under Excelis would pay $1,465 a year, and a family would pay $3,663 per year. Under Humana, that would be $549 per year, a savings of $900 for that retiree, and for a family would be $1,098, which would be a savings of $2,500 a year for that retiree. So as you can see, that's a lot of information in a short period of time, and it's a pretty detailed analysis. This is the same analysis that I have given to NYSET for several years to evaluate when we were considering this option for retirees. They have always come back and agreed with us that these coverages were as good or better than what we have in place now. So that was always a good news. And with that, we can open it up to anybody who has any questions. We will try to answer for them.
Mr. Ryder.
Yeah, Joe. Do all the retirees fall under this, or is it just those over 65?
Just those over 65.
Just those over 65. All right. If something would happen to me, and then my wife would not have insurance because I pay the family insurance, does Humana offer her a COBRA of some sort?
Joe, do you guys have a survivor benefit there on your program?
I believe I do. I'd have to pull the contract up and look at it, but I believe we do.
Okay, so with that answer, sir, what I'm referring to is, and Joe would have to verify in the contract, but a lot of times if a retiree passes away, there's a survivor benefit, which means that your wife could pay for this coverage. So just like COBRA, but it's extended longer than COBRA. So there would be a benefit for her.
There is a benefit available for her.
Yep.
All right. I was the individual who called in the other day and spoke to the retirees from other districts, and my point was none of them said too much other than the man from JC said he had no problem with Humana. But Walton has Aetna. Deposit has Hartford.
Yep.
CV, and I spoke to, has Blue Cross Blue Shield. So I really didn't make the statement that all were happy because a lot of them have not had the use of it yet. Just to clarify that point.
So your point was there was just different carriers. You didn't hear any complaints. There were just different carriers for different school districts.
Yes.
Yes, and that's really what happens. I mean, based on the size of the district and based on the benefit setting, different carriers will be competitive in different districts. So that is not uncommon. You know, in that list on my PowerPoint, there's only one group that's with Excelis, which is Shenango Valley, and then a lot of those groups it's a combination of Hartford, Humana, and Aetna.
Yes, that's what they were.
Yep.
So what you've just explained basically is I would pay $1,098 for my family coverage under Humana. Is that correct?
Yes. Yep.
Because last year under Blue Cross Blue Shield, I paid $35.63.76.
So you're paying.
That was the check that I wrote to the school last year.
Yep. So you're paying the 15% roughly.
I have no clue.
Yeah, if you paid that price to the
I paid.
district, you're in the area of 15%. So yes, that comparison for you would be almost identical. You'd be going from 3,500 roughly to a little over 1,000, almost $1,100.
Yes.
Yep.
Okay. If this, let me understand the sunset clause. For 5 years, the district is going to have the self-insured part on their end, right?
Mr. Ryder, that would have to be negotiated. It's usually a 5-year
Yeah.
period. And I know NICET has negotiated this with other districts. And the reason it's usually a 5-year period is we don't know if Blue Cross and Blue Shield will change over those 5 years. So it's hard to go out and say, okay, we can guarantee it for 10, 15, or 20, because Blue Cross Blue Shield, they can change their benefits over those times. So I would really again, I have not negotiated this before. Our labor relations specialist, who's Chris Wilkinson, has negotiated this before for other districts. And I believe the union will be working with a man by the name of Chris Corlett, who has also done this for other districts. So that's where the 5 years comes up.
Okay, well, I guess my point was that the Blue Cross Blue Shield does not have a limit on it, what we have right now. But if we go to Humana, you're part of the self-insured is you're going to negotiate for 5 years. Is that correct?
The Humana would stay in place. The safety net, and again, we use 5 years. That's not been negotiated yet. So that would have to be negotiated again between the district and the different bargaining units. But the Humana plan, and correct me if I'm wrong, Ed, would not change in 5 years. The only thing would be the safety net.
That's correct. I mean, in all my districts that I've got that currently have Medicare plans, only 2 of them added that extra layer. And what happened was one was Maine Endwell. And in the 5 years that they did that, they, I believe, spent in the area of $75, and I forget what it was, but it was some program or some, I don't know, some version of maybe a stocking, but they did cover it. And then after they moved to Humana, because they went from Hartford to Humana, I believe they took that off the shelf. The other district was Harpersville, and Harpersville self-insured, and the only money they spent was they ran into a private contracting podiatrist, and they paid a couple $100 in benefits to that podiatrist, and then the retiree, I believe, changed providers. And then they've also moved away from the Hartford, and they moved to Aetna. So in both situations, I believe they started out with a self-insurance, and then that was taken away because there really was not a lot the district was paying. The retirees felt comfortable with the benefit set that they had from the carrier.
And Mr. Ryder, this is absolutely just a safety net. We're 99.99% absolutely positive this will not happen. But we as a district want to put that out there just because to put that one more layer of caution for the retirees, just to put their mind at ease. Yeah,
I could see that, and that's very good. But my question was, why 5 years? That's all.
I think that's the industry standard. And Chris Corlett and Chris Wilkinson, the 2 people, and again, I can't speak for the CFTA. I know he's their NICET rep, and Chris Wilkinson's our rep at the school district. They've actually done this before, so I would look to those 2 gentlemen for guidance.
Okay, and my last question, I guess, is what number were you using to come up with all your figures for the number of retirees over 65?
Kristen Wall, do you have that number?
Yep, we received that from a census that we were provided.
Yep, and what was it? Do you have the number there, Kristen? How many people it is?
Yep. 1 second.
I have it, Kristen. I had 279 right at that number. That was inclusive of spouses, I believe.
Right.
Correct.
So with spouses is 279 people.
We had to include the spouses because they're on their own plans once they move over to a Aetna or Humana plan.
Yep.
Alice too.
280.
So as I refer in the industry, it's 280 belly buttons.
Mm-hmm.
I guess I was under the impression that we had about 240, 245 retirees, of which I can't believe 50% of them would be 65 and older.
Sir, I've got, with the census that we received, We have about 214 retiree contracts. And then when we added in the spouses, that's where we came up with the 283.
All right, so
And that's leaving some of the under 65 on the active plan.
Right.
So basically you assumed that everybody had the family plan.
No, we actually had a census that included the spouses. We asked
Right.
for that specifically. We didn't want to make any assumptions. We wanted to get as close to your accurate number as possible. So the census was a period of time, so that could have changed, a couple months ago, but that's where we came up with those numbers, is based off the census from the district.
Okay, thank you very much.
Thank you, Mr. Ryder. Any other questions?
Yes, this is Al Jones. Does this plan involve non-teachers that are retired? My wife is a retired aide, and we're both under 65. So I know Medicare has got nothing to do with anything that we'd be applying for. So would we only be looking at the Blue Cross Blue Shield Classic Blue plan? And is this also a rate that involves aides, not just teachers?
It's all Mr. Jones, but again, it wouldn't affect you, and Ed, correct me if I'm wrong, until you reach age 65.
That's correct. Anybody under 65, this would not apply to until they turn 65. So right now they would stay on the Classic Blue plan, and they would not come across with everybody else.
The Classic Blue plan, though, that would be the far left column.
That's correct. Yep.
And if this is the gross monthly rate, and I guess you wouldn't know, but what would be the percentage that the employees are responsible for?
Well, different bargaining groups pay different numbers, so I don't have that information. Joe, do you know off the top of your head what the different
I would have to
groups
go
pay?
back to the individual contracts to do that.
Okay, so this is what the school is being requested, but how much of it is going to be requested of the employees is it's not noted here.
Right, but one point I want to make out is that whatever the retirees are paying now in their contribution will not change. So whatever you negotiated as your percentage, whether it be 5%, 10%, 15%, that is not going to change. So whatever your percentage is will remain the same because of your contract. It's just that if once you turn 65, and if we made the decision to move over to these plans, you would pay a lower premium than you currently do now with Excelis.
Right, go back to Mr. Ryder a minute ago. His percentage is not going to change. We just spoke about that. But what he's going to pay yearly under the new plan will change because it's a cheaper plan. But his percentage won't change.
Correct.
All right, so individual rates won't, when would those actually be provided?
I think once a final decision was made, I think the district would then put out a sheet to say, based on your bargaining unit, if you're in this unit, you're paying this, and this would be your cost. And if you're in this unit, this would be your percentage, and this is what it would cost. And they would probably show you what you're paying today, and then show you what you'd be paying tomorrow versus the new plan. So once a final decision would be made, I'm sure that, Mark or somebody would be able to put that out to say, here's what you're currently paying, to show people how much they would save on their plan.
Yeah, I appreciate it. I guess I just got just looking at the $2,000 number, I was thinking that was what we were required to pay. But now I understand it's what the school is responsible for, of which we pay a portion.
Yeah, people don't realize
very well
what the
thought.
cost of healthcare is. And they don't realize what these districts are paying for healthcare. It's a lot of money. Now, they're great benefits, but it's a lot of money.
About 60% of the school budget is healthcare, benefits, and salaries.
All right, I appreciate that clarification, and I'll just wait for the communication or the document that shows what the individual cost is, and I think we'll be fine with that. Thank you.
Okay.
Thank you. Other questions? If there's no other questions, then we're going to do this again at 2 o'clock today. And there's been a change tonight due to the board meeting. Our third one today is going to be at 7 o'clock.
Yep.
We're going to do 2 o'clock and then 7 o'clock.
And it's the same pass code, right, Joe?
Yep. You can get everything
Okay.
right on the webpage like you did for this meeting.
Yep, we're good to go.
One last time, any questions before we end this meeting? Okay, everybody on the call, have a good day.
Have a good day, everybody. Thank you.
Summit too. Thanks. Bye.